Hello, my name is Pamela Valancourt, and this is a voiceover presentation discussing TeachBack education and its effect on prevention of hospital readmission in heart failure patients. Given that heart failure can account for the largest diagnosis in terms of Medicare recipients and that costs are estimated at over $34 billion annually, it has become important to our healthcare systems to find ways to better manage this population. A study done in the Managed Healthcare Journal recognizes the role early education and comprehension can have when teaching management of symptoms and the effect it has on prevention of hospital readmission. It is estimated that about 24% of heart failure patients are readmitted to the hospital within 30 days, despite advances in medical therapy. This results in loss of reimbursement from the health insurance companies to the hospital. Over time, as you can imagine, this creates a massive financial burden on the facilities caring for these patients. Given the unpredictability of this disease, as healthcare providers, it is up to us to give our patients the necessary tools to continue to manage their symptoms at home. The purpose of this project is to evaluate education's effectiveness in disease management using a teach-back method to ensure understanding of information given to a population of heart failure patients admitted to the hospital in a local community. To begin this evidence-based project, I started with the clinical question at hand. For patients diagnosed with heart failure, can education regarding management of the disease reduce hospital readmission versus receiving no education at all? A database search of CINAHL and PubMed databases retrieved a total of 374 research articles related to this topic. From there, further criteria was applied to narrow down the search more specific to what I was trying to evaluate. An advanced search was conducted to include such keywords as heart failure, education, and hospital readmission. Articles were further narrowed down by limiting to articles less than 5 years old, a level of evidence greater than 3, and the use of English as a primary language. After application of criteria specifications were applied, 81 articles were relevant to my search. Of those 81, 4 were chosen and used for this project. After reviewing each article, it became evident that proper education can play a vital role in better symptom management for patients. This in turn can reduce the need for hospital readmission on such a frequent basis for this population. The incidence of heart failure is sweeping our nation, and cost of managing heart failure has created a large financial burden on our healthcare systems. It has become apparent that as healthcare providers, we need to spend the time to find low-cost solutions to this problem. Some key points I would like to mention from the article research I have conducted is that education and proper understanding of materials used should be evaluated for each heart failure patient admitted to the hospital. Using a teach-back method is a way to ensure the patient understands what is being taught. It provides an opportunity for a question and answer, where the patient has the opportunity to seek clarification on their disease management. It is also important to involve other departments of the hospital, as there are many elements of managing this disease. For example, asking the dietitian to speak to the patient about food choices and weighing themselves every day. Using tactile information for distribution, such as a brochure or pamphlet, will serve as a reminder and reference tool for the patient to have on hand at home as a reminder of proper disease management tips. It is also important to involve support systems of the patient. This is referring to close family members or friends that can also serve as a reference to the patient. It is no doubt a team effort. Our role is to provide the necessary tools to our patients in order to have a deeper understanding of their disease and the best ways to keep it managed. With any idea comes a plan of action. The best way for implementing this protocol would be to first begin with the nurses. They are the front line when it comes to the initiation of this policy. Informational sessions should be held in facility in order to educate nurses on what we are doing with this initiative and why. These sessions could be held on each unit and kept brief and to the point. Holding sessions on each unit would allow the education to be spread as quickly and efficiently as possible. It would also create the first opportunity to get some feedback from the nurses themselves. Feedback from the nurses implementing this policy will continue to remain important throughout the whole endeavor. Brochures of information are to be developed by a team of voluntary nurses and other members of the multidisciplinary team. The brochure will be given to the patient prior to discharge and will serve as a reference tool at home. The shift of the nurse is no doubt busy. It would serve as a reminder to have an intervention regarding the education built into the EMR record. This way, it would automatically generate and remind the nurse it's time to educate. This would be accomplished by working closely with the IT department. Since we are utilizing resources that already exist within the facility, it will also help to keep costs low. The use of questionnaires and surveys could be set in place in order to gain some after-discharge knowledge regarding the benefit of the education that has been provided. These questionnaires can be mailed, and follow-up phone calls can be placed by the nurse 48 hours after discharge. This serves as a method of evaluating our practice change. Data collected from this process would be evaluated by a team of volunteers that have dedicated their time and efforts to this endeavor. This analysis would be conducted at 3 and 6 months post-initiation of policy change and then annually thereafter. As data collection comes back, modifications to the program can be made as necessary. Sustainability is an important aspect to consider. The longevity of this policy is important for many reasons. First and foremost is the well-being of the patient. With this endeavor, we want to enlighten the patient and give them the knowledge to manage their disease. This creates a confidence in the patient that perhaps did not exist before. Also, if we are successful in this policy change, it will reduce financial strain, as money could be utilized elsewhere, perhaps in a much more beneficial place. In order to sustain, we need cooperation from a team of multidisciplinaries. We need each specialty to give their piece as it pertains to the best management possible for the heart failure population. Utilizing resources within the hospital is also a great way to keep costs low. This will also help sustainability. It would also be interesting to designate an individual to review new evidence-based research as it is published in order to show progress as new research as it develops. This would keep the staff intrigued and prove to them their efforts are making a difference. Engaging the team is also a key element of sustaining this policy. Thank you for listening to my voiceover presentation.